Hello and welcome to the presentation How to Boost Revenues with Cradle to Grave Population Health Management. After listening to the views of healthcare administrators from across the country concerning the management of population health, I think you know that there's a lot of confusion and most of you are probably struggling to find an answer. Maybe it's easier than we think. I'm excited you're here. After exhibiting at the National MGMA conference and meeting with single doctor practices and hospitals and clinics with thousands of providers, it became evident there had to be a better way to alleviate the challenges everyone was facing with their population health initiatives. You might see some of your ideas suggested on conversations, and that's okay. What's unique about this presentation is we will examine population health on a timeline from cradle to grave. Hi, my name is Chris Brown. I am a patient engagement consultant and I help medical practices maximize the effectiveness of their population health initiatives. In other words, I help practices see more of their existing patients and help them acquire more patients. So let's get started. Every morning, your patients are waking to another important milestone. Your younger patients are due for vaccination. All of your patients are due for their yearly wellness exam. Expecting mothers may wake to another appointment with their OB. Good Women's Health strongly suggests women see their gynecologist every year. Every woman turning 40 years old today, well, they should receive an invitation to schedule a mammogram. Any man or woman who turns 50 today, they should receive from you an invitation to schedule a colonoscopy. And patients with chronic diagnosis, well, they have their own set of milestones. With every sunrise, your patients are reaching one of life's important milestones. So let's view those milestones on a timeline. Now, we all think the beginning belongs to babies, but it really belongs to expecting mothers, all of whom need special attention, especially for new moms to be. Your practice should be motivating your patients for regular checkups, of course, but also consider what expecting mothers want to know. Educational content is key. So when you're reaching out to this population, put yourself in their shoes and make sure there are links to purely educational content. New moms also want a direct line of communication with the provider. Two-way texting makes that super easy to provide. Texting eliminates recorded telephone systems and a front desk that may be a bit overwhelmed by all the other expecting mothers. Now, at the start, when that little one joins the family, keeping mom and baby strong and healthy is paramount. For the baby, there are regular well baby exams and immunizations. Motivating moms and dads to get Junior to regular appointments keeps Junior healthy, catches potential issues before they become big issues, and reduces healthcare costs. For mom, regular checkups with their OB/GYN also keeps her healthy and screens her for early diagnosis of potentially serious concerns. Now, moms are busy and they are more responsive to text messages and email than a phone call. The fog of parenthood. It's a fog because rarely does a mother or father raise more than one family. So there's much to learn and lots of growth to occur. Kids need immunization boosters, annual wellness exams, of course. But what parents need is information. They're thinking, is this normal? Should my kid be doing that? They want direct access to the provider. That's where two-way texting really can be a benefit to parents. They get to skip the phone system auto attendant. Two-way text messaging is so much more convenient. Now, the kids are getting older. They're asking increasingly more difficult questions. Google may have helped you answer some of these, like how far away is the moon from the earth. But when it comes to maturation, that may be a bit more complicated in your home. Helping kids grow strong is more than just physically. Mentally and emotionally, they need to be just as strong. Annual wellness exams present an opportunity for a provider to take note of indicators of a potential problem and then make a referral to a specialist. Annual wellness exams also present an opportunity for a parent to ask a provider questions. Motivating your patients to book that annual wellness exam is the hard part. A portion of your parents will always respond to your messaging, but there will always be a portion that rarely, if ever, act on your messaging. We'll talk about how you can change that in a minute. Now let's talk about teens. Being a teen is not the same experience that you or I endured, perhaps. Social media has surely changed the teen landscape, and not all of that is bad and not all of that is good. Again, annual wellness exams represent an inspection station. Is the teen developing physically as expected? Mentally, is the teen on the right road? Socially, I just attended a conference that focused on the social determinants of health. Providers should take a note of a teen's living conditions. Is there a roof over their head? Is there any sign of abuse? What about signs of hunger? What about drug abuse, alcohol, tobacco, or vaping? Teens who are active in sports are required by their school or club to have an annual physical. Are you able to identify all of the teens in your patient base that are active in sports? Could you be more proactive with your messaging in this area or any of the other areas we've discussed? Messaging to parents of teens becomes more complicated because the subject matter has become more complicated. Now, by the time those teens leave the home, most parents are more than ready for a midlife crisis. At this point in a person's life, their healthcare provider is usually pretty good at proactively reaching out. You're more than likely sending a message to every man and woman over the age of 50 and saying, Mr. Brown, yes, you've reached a very important milestone in your life. You may want to go ahead and buy that Porsche, but more importantly, you should schedule a colonoscopy first. Are you having those conversations with your midlife crisis patients? The golden years, as you know, your older patients need access to healthcare more often than at any other time in their lives. Active messaging should not only remind them of appointments, but also work to build their trust in your practice. You should be identifying populations more apt to develop chronic conditions like diabetes and be proactive in your messaging. If your practice has specialists on staff, make sure you mix their skills into the messaging mix. Seniors are also more likely to attend open houses and healthcare fairs, all of which are effective in identifying patients who may be exhibiting symptoms of a more serious issue. So how do you reach seniors? Now, they're quickly becoming more tech savvy, or they have access to a grandchild who can help them access their email or text messages. So don't be afraid to text and email this audience, but also realize that direct mail may be much more effective for this audience. So let's take a bird's eye view of the cradle to grave timeline. Each stage of life represents a somewhat unique opportunity for a healthcare provider to communicate with their patients. Communication choices change over time, but the most effective methods of communication now are text messages and email. Two-way texting, in my opinion, should be a staple at the front desk of every practice. Now, I know what you're thinking. Chris, our practice does all of the things that you've talked about. Well, that's good. Let's take a look at all the stuff you're doing, or at least what you say you're doing, that maximizes your efforts to motivate your patients. I think you'll be surprised by how long this list really is. Now, here's all that's required to pull off a successful population health initiative. Just one. So let's look at it. The task list for each one of these. Do you have the right message to the right patient at the right time? Is your messaging continuous? Is it automated? Are you tracking? Are you reporting? Is there an ROI analysis at the end of every population health initiative? The task list for text messaging. Are you scrubbing the data? Are you optimizing the cadence? Is the message custom to that population health initiative? Is the voice and brand in alignment? Is the message personalized and meaningful? And are you managing opt-outs? And that's just the task list for text messaging. It's pretty much repeated for email messaging. And two-way texting? Well, let's look at that for a minute. Are all the landlines text enabled? In other words, are they able to send and receive text messages? Has your staff been trained? Do they know how to respond to your patients using text? Is it HIPAA compliant? Are you using message scoring? Are you able to forward messages? Is there any type of quality control in place? Are you tracking? Are you reporting? Again, a lot going on there. If you still think you're doing all that's necessary to pull off a successful initiative, I'm willing to bet you're now rethinking your answer. Because once you put all of these task lists on a piece of paper, you're looking at it and going, that is a lot of stuff that needs to be done just for one population health initiative. But here's the bigger question. Why? Why are you doing all of this? You're a healthcare professional tasked with managing population health initiatives. Actually doing the work is like somebody giving you a wrench and telling you to change out that transmission in your car. The point is this: you don't have the skill set, the time, nor the tools to really pull off a successful campaign for every patient at every stage of their life. Or maybe you do. And again, if you do, again, you're a rock star. We salute you. If you think you do, let's take a closer look. Trying to plan, implement, and manage patient engagement on your own is a major pain, and the results are usually mediocre at best, unless you're a rock star, in which case we salute you. Let's take a look at the pain of doing all this on your own. So you got to generate a call list. Well, that's time consuming. Think about it. You got to generate the list. You got to scrub the list. You got to print a different list for each location. You got to deliver lists to an already overworked front desk team. You got to explain the list to them. You got to manage the phone calls. You got to gather the resulting data if possible. And you've got to report all that to executive management team. That's time consuming. Generating call lists is also non-digital and inefficient. It's 2019. Why are we printing lists? Why are we calling people on the phone when you know half won't even answer the call? It's an inefficient use of time. Think about it. Pick up the phone, dial the number, wait for an answer, leave a message, or worse, deal with an agitated patient. It also adds to the cost of healthcare. Using an inefficient, outdated method to drive a population health initiative is quite the paradox, because a population health initiative was originally designed to reduce healthcare costs. Generating call lists also has questionable results, if you even know what the results are. Are you able to quickly view the results, or do you have to compare a call list to an appointment list to find your results? If the results are less than impressive, then what's the whole point of doing call lists? Fact: phone calls as a method to drive patient behavior is the least effective method compared to text messaging, email messaging, direct mail, and two-way texting. And there's a personal perspective here. Do you really want to put your name to this type of activity? I don't think so. Now, calling patients does not make your coworkers happy. Your front desk team is already busy. Imagine their point of view. They've got a room full of frustrated patients waiting to see a doctor. There's incoming calls from patients looking for earlier appointments. When your front desk receives that list of phone calls they need to make, they may smile, but inside they're thinking, "Are you kidding me?" Calling patients to schedule an appointment from the front desk does not impress your patients. They're thinking to themselves, "I've been sitting here for 20 minutes. Maybe if you stayed off the phone, you could do something about the wait time." Calling patients doesn't move the needle. How many phone calls aren't even answered? How many messages are being left? How many patients actually call back? It adds to the cost of healthcare. Anybody listening to your front desk team make phone calls is going to shake their head and say, "Surely there's a better way to do this." More pain, out of control opt-outs. When your patient receives a text message or an email, they may opt out, and that cuts off communication. You're never able to send them another email or text message, and it's difficult to get a patient to opt in after they've opted out. Technically, it's not easy, and emotionally, few people ever opt back in, and it weakens your ability to effectively communicate. What's the value of one patient to your practice? One wellness visit over 10 years? Is it $1,000? Is it $1,500? Is it $10,000? So every opt-out threatens production. More pain. You can't measure the results. There's no automated tracking. You have to go get the data. And any data that is available is manually tracked and therefore questionable. And any type of analysis requires considerable time. And any analysis is going to be questionable due to the difficulty in getting the data and probably not getting all the data for a complete picture. And there's going to be confusion. You can't maximize the results. You're probably getting the same mediocre results with every campaign you're doing. You don't have access to the skill set or the talent or the tools necessary to bump up response. You need better messaging, better creative, better audience selection, and you can't really track results between campaigns. Did this campaign really do better, or are my numbers questionable? If this campaign did do better, do you know why? And you can't quantify the success or failure to executive management. And this may be where the real pain is, when you're being asked to justify all of your time that you're putting into a particular population health initiative. You can't justify your spend. It's difficult to defend your budget when you can't quantify your success. You're betting your career on gut feelings. It puts you at the mercy of executive management. And you're missing an opportunity to impress executive management, advance your career. Trying to plan, implement, and manage patient engagement on your own is a major pain. So now you're thinking, well, okay, what's the alternative? Well, a patient engagement solution like RelevantMD, and there are several out there, does the heavy lifting for you. The program scrubs your data, it creates your messaging, it creates your creative, it does the scheduling, it provides all the tracking and the reporting you need in order to look good and be able to justify your activities to the executive management team. The neat part about patient engagement companies is that important communication is accomplished quickly, professionally, and there are proven results, trackable results. For example, every woman over the age of 40 in your patient base should receive some education and an invitation motivating them to schedule mammogram. And that consistent, gentle motivation should continue until she has been seen. Maybe she chooses to be seen at 45. Now it will be in her best interest to visit annually. Now, that's a major pain for the typical healthcare administrator saddled with population health responsibilities. But if they're able to ring a bell and have that task completed or accomplished routinely with real-time trackable results, well, that's when you see real change, better health at lower costs. Some practices are apt to want to hire more staff to get the job done. Some practices will try to do it themselves, but waste dollars because they don't have the skill set or time or budget to do it right. RelevantMD can do it for as low as $149 per month. Send me a note after the presentation and I'll show you what's included in the price. I think you'll be amazed really at what we can do at that price. As I noted before, the most meaningful ways to connect are direct mail, email, texting, and two-way texting. So let's take a look at best practices for each of these. Take careful note because here's some gems of information that you could put to work today. The do's for texting. You want to personalize the message. Start the message with the patient's name. Keep it simple. Identify what you want them to do and then communicate that idea succinctly. Make sure the message is important and unique. Have you ever got one of those text messages that says, "Hey, what's going on?" I hate those. Provide and respect opt-outs. It's a legal requirement anyway. Follow texting format rules. Just as you would never use all uppercase caps in a personal text message, you shouldn't do it here either. But I've actually seen that happen. Now the don'ts. You don't want to be sending too many texts. If you overwhelm your patients with messages, they will get tired really fast and they'll opt out. Another don't is selling rather than caring. The number one motivation is to improve or maintain the health of your patients. Make that loud and clear. Ignoring opt-outs. This isn't an issue if you're using RelevantMD, for example, because the system automatically removes opt-outs. Using out-of-the-box templates. Now let me tell you a story. I had an appointment with my doctor and I received an appointment reminder. The message started with my name in all upper caps and then proceeded to tell me, remind me of my appointment. Just that same afternoon, my colleague who sits in the same office received a text message reminder from his practice, which is completely different from mine. It was the exact same message. So obviously these two practices are using the same system and using a template, and it looked very unprofessional. Here's some do's and don'ts for email and text. Let's take a look. So personalized. Important here. Write the message as if you were speaking to a friend. Keep it short. Nobody likes to read long copy. Make it relevant. Make sure that email shows up when it matters most. Educate. As a healthcare professional, share what you know when it could improve health. Add value. A link to a helpful article about balanced nutrition may make sense when messaging to a parent, for example. And don't do these things. Don't flood the inbox. Keep your messages relevant as it pertains to time. You're not selling, you're encouraging wise action when it matters most. Don't sell, show genuine concern. Don't use out-of-the-box templates, just as we talked about earlier. And don't sound impersonal. Templates are impersonal, so use a skilled copywriter to craft your messages. Now let's talk about direct mail. You may be thinking this. Nobody reads direct mail. Well, listen, direct mail is junk mail when it's sent to the wrong person. But you know your patients, you know a lot about them. So keep it highly targeted as if you were sending a birthday card to a friend. Direct mail validates all of your other forms of communication. It should be used in tandem with other important messages. What's the worst thing you can do if you use direct mail? Don't use a discount postcard company. These guys focus on providing you the absolute lowest cost to mail something. If you're more worried about how much direct mail will cost than the ROI, you're making a mistake. Make no mistake, direct mail is the most expensive way to communicate with your patients. So make sure you consult with an experienced marketer, and those guys will never be found at a discount mailing company, and ask them how to send your direct mail the most effective way possible. As a bonus for sticking with me, I'm going to share 3 secrets to successful marketing. First, make sure your messaging promotes your unique selling point. What makes you different from the medical practice across town or down the street? Make sure you're communicating that. Second, look professional. If you don't have the copywriting, design, and database skills, then find someone who does. RelevantMD, as an example, has more than 23 years of marketing experience. That's the type of company you need to help with your messaging. Third, be consistent. A successful messaging system will continually reach out to your patients with the right message at the right time. Every message is a touch point, and you don't want to be a stranger to your patients. Most important, let me add one more secret to success. Measure every effort. You must be able to track ROI. For every dollar you spend on marketing, how many dollars are coming back? And what does it cost you to motivate a patient to make an appointment? A system like RelevantMD tracks the results of every messaging campaign. For example, if you launch a mammogram campaign, you must be able to see the results in real time. How many messages were sent? How many were read? How many mammograms were scheduled? And what's the value of those appointments compared to the cost of the campaign? Let me tell you a story. I was meeting with a large medical group just the other day. They were looking at CRM software. What is CRM software? CRM software is customer relationship management. It's a collection of tools that help you communicate with customers, or in this case with patients. These tools are very powerful, but in the end they are really only tools. You still need to know how to use those tools to be successful. In other words, you could have every tool known to man, but you still would not be able to change the transmission in your car if you don't have that knowledge. So, in other words, you could buy the most expensive CRM and still fail miserably at communicating with your patients. Why? Because someone still needs to determine which population to target, write the message, schedule the message, and track the results. If you don't have the skills to conduct a successful messaging campaign now, even the most expensive CRM won't change that fact. Nobody likes a tool. The bottom line about population health is this: if you're serious about patient messaging in the interest of improving the quality of care, improving the health of your patients, and reducing costs, you need a professional marketer. Now, I'm sure you have questions, and you can send me a note at chris@relevantmd.com, or you can call me at 800-201-1995. I'm available to show you how the RelevantMD software tracks the results and can help you make every population health initiative a success. Just give me a call. And thank you for joining me. I appreciate your time and wish you the absolute very best. Bye-bye.